Good morning, everyone. Thanks so much for being with us. This is Sports Medicine Weekly on this Saturday morning. I'm Steve Cashel, joined by my usual co-host. He is Dr. Brian Cole, the head team physician for the Chicago Bulls, one of the team physicians for the Chicago White Sox, sports medicine specialist, orthopedic surgeons at Midwest Orthopedics at Rush. Our website is sportsmedicineweekly.com. Our producer is Shane Reardon. Dr. Cole, how are you on this Saturday morning?
Steve, I'm well. Everyone's healthy around me. Just dealing with all the issues that everyone around us is dealing with, but moving forward.
Good. Well, quick opening topic here. Infected elite and pro athletes trying to get back to sports. Interviews with athletes have been done, Dr. Cole, who have contracted the virus, from professionals to college athletes to weekend hobbyists, and they're revealing their surprise at the potency of its symptoms, struggles to reestablish workout regimens, lingering battles with lung issues and muscle weakness, and unsettling bouts of anxiety about whether they would be able to match their physical peaks. What are you seeing with some of the pro athletes you're working with?
Well, Steve, full admission, I have yet, thankfully, to see or work with a professional athlete who's had COVID, and and the ones who have been in the media, the public eye, have generally had very mild symptoms. That being said, there probably have been a few that have had it in a very significant way, and I've certainly had patients who are very active come in for injury management, shoulder, elbow, knee, and so forth. And in discussions with them, I will tell you, this thing just can really beat the heck out of someone. And it's so much different than the H flu or other viruses that you and I may have had in the past, in that it's so virulent and has such a dramatic effect on your pulmonary physiology, meaning your lungs, your fatigue, your endurance, that it's, even when you're out of the woods and not infectious anymore, the lingering effects on one's body have been pretty tremendous. Having spoken to one of my close colleagues who had it, it was during the 2 weeks that he was really symptomatic. I would talk to him every day, and it was brutal just to listen to him. These coughing fits, you feel like you're at altitude all the time when you can't get enough oxygen, hypersensitivity of your airways, just getting up out of bed to go to the bathroom or to brush your teeth or to try to get some food, was a monumental effort. And many of those symptoms have lingered in individuals, and it's a huge source of anxiety. It's like recovering from injury. You're like, when am I ever going to get well? And I've talked to people who've had 6, 8, 10, 12 weeks of symptoms like that. So it's brutal. And even when an athlete gets beyond sort of the subacute phase where they have these lingering symptoms, in the elite athlete, our biggest concern is the effects on the heart or the cardiac system, because our bigger concerns are, does it leave the heart at some degree of vulnerability for an arrhythmia or to have an abnormal electronic pathways through the heart, or an irritability that could lead to something catastrophic. And part of our protocols, in fact, for elite athletes will often include a formal cardiac assessment if someone has been known to be sick and symptomatic with COVID. So it's brutal, and I think that's going to be sort of the next discussion we're going to have, is how do we competently evaluate our athletes, make sure or active patients, make sure that they're safe to return back to sport and don't suffer any adverse consequences related to their heart. That's really going to be tragic if some of those things happen, and to date we have our eye on